I'd like to turn it over to Health Director Gibby Harris. Gibby.
Thank you, Bill. Good afternoon, everyone. Thank you for being with us. I am Gibby Harris, the Public Health Director for Mecklenburg County, and I have with me Dr. Meg Sullivan, our Public Health Medical Director. We have some brief updates for you, and then we'll be opening up for questions. Just a quick note, our data, our metrics continue to decline. We're seeing improvements on a regular basis. They're slowing down just a little bit, but we're still seeing that decline in cases, in our percent positivity rate, in our hospitalizations, and in the number of outbreaks in the county and our long-term care facilities. In addition to that, we continue to see a reduction in the need for testing being requested by our community. So we're watching all of those metrics on a regular basis. As we always say, this virus has been nothing but unpredictable, so we'll continue to watch that and make adjustments as needed. Everyone should be aware now that the governor's executive order is changing this afternoon, Friday afternoon at 5 o'clock. He is canceling the stay-at-home order and is increasing the capacity options for multiple venues in our community with safety measures in place. In addition to that, I'm also announcing that our public health directive will expire Friday the 26th, that's tomorrow at 5 p.m. in accordance with the governor's executive order. But as I say that, I want to make clear that our situation is improving, but it is not in a place where we should all be comfortable to go back to life as normal. We continue to have high levels of virus in our community, and we continue to need to stay the course when it comes to issues of wearing masks, socially distancing, avoiding large groups, and spending most of your time with the people that you live with. So I want to reinforce those messages. Those are critical as we move forward. The thing that I'll say about this governor's order and the lapsing of the directive is that it shows the improvements that we're seeing in our community, but it also indicates the need for us to take that seriously and to move forward slowly and intentionally. That means that both our businesses as well as our individuals in this community need to think seriously about their behavior as we move forward. We want this to work. We want the openings to be something that is sustainable as we move forward, but we need our numbers to continue to move in the right direction. And that means we need our community to continue to do the right thing and for our businesses to do that as well. I know it's tempting just as things are opening up to just get back out and enjoy life as much as you can. And I appreciate that, but at the same time, we want this to be sustainable, which means we've got to continue to be cautious. And lastly, I'll just mention that as part of this transition from the governor's order, county services will be reverting to where they were prior to the directive here in Mecklenburg County on Monday. Our staff are planning and preparing for that change in service delivery over the weekend, and again, services will be available on Monday. You can check the county website for updates on that as we move through the weekend. And then I did say lastly, but I'll mention one more thing. Just a quick update on the encampment site. All of the plans for eradication of the rodents have been received and approved by the owners of the properties out there. There has been some fencing of the area that's being added by the individual property owners. The eradication work has started and is in progress in and around all of the sites. Our staff will continue to review the situation out there for a month. We will be making visits twice a week to make sure that we don't see any evidence of additional rodent activity. And if we do, work with the property owners to make sure that their pest control companies are doing what they need to do to eradicate that immediately. We will continue to review the progress out there and make sure that we have come to some conclusion before we provide any approval to move forward to the property owners with confirmation of completion of the work. So with that, I will turn it over to Dr. Sullivan for an update on vaccines.
Thank you, Gibby, and good afternoon, everyone. As a brief update for COVID vaccine from Mecklenburg County Public Health, we have now administered over 40,000 doses of the COVID vaccine through Mecklenburg County Public Health, including almost 25,000 first doses and over 15,000 second doses. Again, we are continuing to follow North Carolina Department of Health and Human Services prioritization guidance by vaccinated individuals in Group 1, Group 2, and then beginning yesterday, February 24th, our child care and pre-K through 12 school staff. We want to again encourage any individuals who fit into these groups, which include our individuals in Group 2 over the age of 65 who have not yet been vaccinated, to call our hotline at 980-314-9400, option 3 for English or option 8 for Spanish, and or join our wait list online. We also know that multiple vaccine providers, including our 2 hospital systems, and now some of our pharmacies are providing vaccine appointments in the community. We're working hard to make sure that information is available as well. We've also been working hard to collaborate with some of our other enrolled vaccine providers in the community that serve those populations disproportionately impacted by COVID to transfer vaccine, again, in order to further extend our reach and impact of the COVID vaccine. We continue to follow our vaccine equity plan by conducting outreach to community partners and community leaders and doing numerous vaccine events to reach our prioritized population, and are continuing to work with our hospital partners and childcare and school leadership to implement and finalize plans around a coordinated approach to provide vaccines to our childcare and pre-K through 12 staff while still continuing to provide access to our Group 1 and Group 2 residents. We expect to be providing more information about that soon. We are also working hard this week to provide all of the second doses for the clinics and events that were postponed last week due to weather delays, as our shipment has now arrived, and we really hope that there will be no more upcoming weather delays affecting vaccine shipments. And then finally, I just wanted to highlight a few key positive updates regarding the COVID vaccine in general. First, in terms of the Johnson & Johnson vaccine, the FDA released a briefing document yesterday that concluded that this vaccine has significant benefits in reducing both symptomatic and severe illness. And the independent committee of experts will be meeting tomorrow to recommend whether emergency use authorization should be granted, and then we fully expect that emergency use authorization to be granted in the near future, which means the Johnson & Johnson vaccine could be available to the community in the near future. As we know, the Johnson & Johnson vaccine has several advantages, including being a single-dose vaccine with less stringent storage and handling requirements. And it's a very exciting development, especially given the strong data this vaccine has regarding preventing severe disease, hospitalization, and death. In addition to the Johnson & Johnson vaccine, we're hearing positive news that overall supply is increasing. And we continue to work with our community partners to ensure that as more vaccine comes into the community, we continue to distribute it as safely and equitably as possible. And then finally, just wanted to briefly highlight some of the data that's coming out of the US and in other countries that really is showing the real world effectiveness of the COVID vaccines. In addition to the strong clinical trial data, we are now really starting to see this real world impact in decreasing severe disease, decreasing hospitalization, and decreasing death. And again, really want to stress the importance of everybody getting vaccinated when it is their turn. And then just to end though by saying, while we do have really positive news coming out about the vaccine, just to return to what Gibby said, we still only have a small percentage of our population that has been vaccinated. We still have a lot of virus in our community. And while restrictions are easing, we need to just remain as vigilant as ever and continue to follow all the public health prevention measures to limit spread in our community. Thank you.
Thank you, Dr. Sullivan. First question today is to Sean Brown, WSOC-TV.
Good afternoon, and thank you both for your time and for answering our questions. I wanted to ask an update on the call for community vaccination centers. I know the county put out a notice a week or so ago asking for community organizations who are willing to host. I'm curious what data you have on where you're getting responses, how many, and if it's reaching some of those communities that are most in need.
Yeah, thank you for asking that. And I will say we have been really happy with the response that we've received from our community. We have gotten numerous requests from all over the county, many from community-based organizations that really do serve those prioritized populations. We have already worked with some of the partners that submitted the requests and been able to do a couple of the community events. We actually just got off a call with our hospital system where we were discussing this list and sharing it with them, and we'll be sharing it with other vaccine enrolled providers. So I think, again, it's been a variety of requests that we've gotten. It's been really helpful so far, and we really want to encourage people to continue to submit requests.
Next question is Brett Jensen, WBT Radio.
Hi, thanks for doing this, guys. Curious, Gibby, in terms of some of the percentages, I'm just curious, and I'm not like trying to put you in a spot, I promise. I'm just curious in terms of allowing, 30% for bars, but still like 50% now at gyms and stuff like that. Some bar owners are happy, but at the same time, they're a little perplexed as to why they're only being allowed 30% with other places are being allowed much larger percentages. Do you have any thoughts on, I don't know, data or science or just personal thoughts on why there might be discrepancies between bars and breweries and movie theaters and gyms?
That's a great question. I think part of it has to do with the fact that bars, supposedly up to this point, were not supposed to be having individuals inside at all. So I do believe that part of the rationale behind this move is to ease into increases in occupancy in any number of settings. And so from going from 0 to 30% was, I believe, what was thought the best option for bars at this point in time. So that's speculation on my part because I don't know of any specific data that indicates that there's much difference between a bar and a brewery, but breweries had been allowed to continue to have people inside up to this point. So this gives our bars an opportunity to ease into it and also to make sure that they've got the things in place inside their facilities to make sure that they've got the prevention measures in place to make sure that it's a safe environment for people. So I think it's like everything else, it's an easing into rather than just a full open or even an open to 50%.
Next question is Paige Peroso, WBTV.
Hi, y'all. Thanks so much for doing this. Gibby, I know you already gave your warning, but do you think Mecklenburg County is ready for these easing of restrictions, or do you wish that the governor waited a little bit longer before changing some of the restrictions?
That's a great question. And I think one of the challenges here is that, as I mentioned earlier, if nothing else, this virus has been unpredictable. So right now we see our numbers dropping. We see things moving in the right direction. And I have to tell you, I think a lot of that has to do with our community's response to our request for them to do the things that we know help prevent the spread. And I understand the challenges that has presented for people, and both from a business perspective as well as a personal perspective. So I'm pleased that we're at a point where we can open things up. I'm hoping that we take it seriously, that this is an opportunity for us to slowly open things up and be intentional in a way that makes us continue to have safe environments for people. So like I said, so that it's sustainable. My concerns are, number one, there are still some projections out there that the variants are going to cause some major problems for us. We're going to have to keep an eye on that. But my other concern is that people will take these openings as the opportunity to just get out and do whatever they want to. And hopefully that's not going to happen. Our community has taken this seriously over the last month and a half, and I hope they continue to do that.
Next question is Vanessa Rufus, WCNC.
Hey, good afternoon, everyone. Thanks for taking my question. I wanted to talk a bit more about Johnson & Johnson, given, I guess, the less stringent storage and handling that it has, the fact that it's one dose. Have y'all thought about ways that you might use this brand or this product if you do get your hands on it soon?
Yeah, I think it's a great question, and I think we've talked about the Pfizer and Moderna vaccine and some of the challenges that come to it or with the 2 doses and the stringent storage and handling requirements. So I think the Johnson & Johnson vaccine presents 2 really good opportunities. One, I talked about just increased supply, more vaccine, and we need more vaccine in this community, and so the opportunity to use it. And then second, with the single dose and less stringent storage and handling requirements. So I think that there's multiple different ways that it can be used. I think the important thing to focus on is that all of these vaccines, right, are effective in preventing severe disease, death, and hospitalization. And so when we look at opportunities where a single dose would be effective, opportunities where to partner with some of our enrolled providers or vaccinators in the community that might not be able to store the Pfizer and Moderna vaccine, but could do the Johnson & Johnson. I think those are some of the opportunities that we're looking for. But I think just overall, we're excited about the idea of more vaccine.
Next up is Claire Donnelly, WFAE.
Hi, thanks for taking my question. I actually wanted to know about Johnson & Johnson as well. I know we have kind of rough numbers from the state right now about what they're hearing from the federal government about how many doses. Do you know if Mecklenburg would be getting Johnson & Johnson? Basically, what have you guys been hearing from the state?
I mean, we have heard from the state about some possibilities. As I mentioned, I think maybe at the board meeting earlier this week that we've made a request with our healthcare systems to jointly do some extra work around the educational group that we're trying to get vaccinated right now that we started yesterday and requested some additional doses. So we're hopeful still. The state is not going to actually provide confirmation on any of that until after it is confirmed. So, the usage of it is confirmed by the FDA. So we're awaiting that, but we're also planning for the possibility of additional vaccine.
Gibby, it's Allison from the Charlotte Observer. Could you talk about your conversations with local law enforcement partners and with COVID ambassadors and getting ready for tomorrow at 5 p.m., making sure that businesses are following all requirements?
Great question. And I anticipate that we will see some additional complaints, concerns being voiced. Our COVID ambassadors are poised and ready for this weekend, as I know law enforcement is. We've been having conversations between both groups about how we sort of divide and conquer and work through some of the concerns that may be voiced. But again, we're really depending heavily on our businesses to do the right thing this weekend and to make sure that they are sticking to the capacity guidance from the governor and that they're making sure that those prevention opportunities are in place so that there's safe environments for people to come into. So this has to be a joint effort. It all can't be done by the COVID ambassadors. It all can't be done by CMPD. Our businesses need to be compliant and working with us on this so that we can help keep them open. In addition to that, the individuals in our community need to help us with that as well. If you show up at a place that you really wanted to go to, but you see that it's incredibly crowded or there's a line outside the door, then reconsider and think about going back another time. So we're needing everybody's help this weekend to make sure that this goes as smoothly as possible.
Next question is Linnea Lewis, Fox 46.
Hi there. I just had a quick question about the testing. When did you all start to see testing kind of go down? And do you think that with the vaccine rolling out, people are just kind of just winging it and just not getting tested? Or, what do you think may be contributing to that?
I think it's a combination of things. I do think there's a lot more emphasis on the vaccine right now than on getting tested. And the interest that we saw, the huge spike in interest that we saw over the holidays as people were out and about more and were engaged in group settings and were traveling more, there was more interest in testing at that point. So I think some of that behavior has changed over the last month, and that has probably contributed to a lack of need for testing. But I think part of it too is people are more focused on the vaccine at this point in time as well. But we continue to encourage people, if you have been involved in some type of group setting with those other than that you live with, that you consider getting tested. If you've been exposed to somebody who has been thought to have COVID or confirmed to have COVID, that you get tested. And again, if you have symptoms, that you get tested. So we still have testing readily available in our community for free. There is no reason for you to have to pay for it. And so we have that available on our website, and we encourage people to utilize it.
Thank you, Director Harris. Floor is now open for follow-up questions.
Hi.
Claire, oh.
Go on, Claire. Sorry.
Okay, sorry. I was just going to ask, given that we're getting closer and closer to that March 10th date when essential workers can start getting vaccinated, what the planning looks like at the county level for that. I know you had mentioned possibly working with businesses individually. Just any updates there?
Yeah, I think obviously we are anticipating that March 10th date, right now, as I mentioned, still really focused on our groups 1, groups 2, and then childcare and pre-K through 12 staff that have already, yes, engaged in significant planning with our hospital partners, with our other community partners, and really started talking about what that looks like on different levels. So I think it'll be a continued combination of offering, as much vaccine as available, working to get it out again as quickly and equitably as possible through fixed sites, through targeted community events, and then through kind of targeted access points with specific groups that fit under Group 3 to be able to work to get as many Group 3 vaccinated as quickly as possible. Obviously, a lot of Group 3 plans depends on vaccine supply. That continues to be the rate limiting step. And again, as I mentioned, I think we're optimistic that we're really moving in the right direction with that supply, but we still, a lot will be told over the next few weeks about how much vaccine will actually be available.
Hi, this is Vanessa again with WCNC Charlotte. I just wanted to follow up on the statement that the county facilities would be returning back to like normal operations from before the directive. Since we had previously covered some concerns from the tennis community, I just wanted to confirm that that means that people could be potentially playing after dusk with lights on at those tennis sites.
So obviously, I don't make decisions for all the departments in the county. And so each of those departments is working through their processes. That information should be available at least by tomorrow, and will be on our website as well. But for the most part, what I believe is being done is we're moving back to the amount of service that was being provided prior to the directive starting on Monday.
Hi, this is Paige Peroso again from WBTV. We've heard that the county is holding clinics specifically, or vaccine clinics specifically for child care providers and for bus drivers at a bus lot. When and where are those happening, and when do those appointments open if they're different from the county website, I guess?
Yeah, so I think as I mentioned, we are working both to provide vaccine at our fixed sites and then do events in the community. And we have been planning different events or working with our childcare providers to provide some, we're actually doing an event this weekend where we will have some appointments that are specifically for childcare providers, and then are working with CMS to potentially work through different ways to provide access, which includes potentially providing those. Some of these details are still being worked out. When those appointments become available, again, we work through our community partners to be able to make those appointments available to those specifically prioritized populations. But again, this is an ongoing planning process.
Dr. Sullivan, it's Allison from The Observer. Can you tell us how long is the wait list right now to get vaccinated? Do you have a breakdown of how many folks are in each group, and maybe how many people get pulled from the wait list each day to be able to get vaccinated?
Those are good questions. I don't have all of that specific data. I do know that we have approximately 6,000 people right now on the wait list, and my understanding is the overwhelming majority of those fall into our educator group. So again, childcare and pre-K through 12. And we do have individuals that are in our Group 1 and Group 2, especially those over 65. We are working to find availability. And so I've said this before, but we do encourage anyone who is over 65 that has not been vaccinated to reach out to us, because that is something that we're really trying to do. In terms of how often people get pulled, it really depends. I think one of the things that we are finding is that as more vaccine appointments become available in the community, through our hospital systems, now through pharmacies and other enrolled providers, people are sometimes making multiple appointments. And so we're really encouraging people, if they are going to do that, to make sure they're canceling the other appointments so they're not holding slots for others. And so then as soon as we see an appointment's been canceled or we have increased vaccine availability, we're quickly going from our wait list to fill those. And so we want to make sure the community is engaged in that as well. So it does vary every day how often we're doing that, but it's something that our hotline staff is working, literally around the clock to try and make sure we get every single appointment filled.
Next question, please.
I do have an additional follow-up. This is Deshawn from WSOC. I wanted to ask regarding the vaccine, just given the number of doses that have already been distributed, what is the monitoring or tracking process on the county level regarding any adverse effects? And if so, what are you seeing or anything that stands out based on what you're hearing so far?
Yeah, so this is true for anyone who's administering vaccine. We require people to stay afterwards for at least 15 minutes, if not 30, depending on their allergy history, to monitor for any immediate reactions. And I will say we have seen an incredibly minimal number of immediate reactions afterwards. We then also, really talk with people about what to expect as normal side effects and then when to be concerned and when to follow up. And again, we have not heard a significant number of any significant or severe adverse effects. The other thing that we do is every time someone comes to get a vaccine, we give them information about a program that's called VSafe, which is actually run through the CDC, but it encourages anybody who gets vaccinated to register through this program. And then they receive a questionnaire on a scheduled basis. So a day after they get the vaccine, a few days, a week, a month, a reminder about a second dose. And then after that, and they kind of answer questions around whether they've had any side effects, whether they've had any changes in their health. It also asks about pregnancy. And so I think this is also a way to do it on the population level. And I know this is being monitored. I think right now we continue to feel really confident in what the clinical trial data showed, that the vaccine is incredibly safe and effective, but it's something we still encourage people to do, to report any side effects that they have so they can be properly, any severe adverse events, I should say, that they have so they can be properly investigated.
Hi, this is Vanessa again with WCNC Charlotte. Something Dr. Sullivan said about people making multiple appointments reminded me about out of South Carolina. It sounds like DHEC was pointing out how some folks are vaccine hunting, particularly for those second doses. So I was wondering if you could walk through, can people get their second dose from a different site? Should they be getting their second dose from a different site?
So I think in general, the way that supply is allocated, the number of second doses that are allocated are based on how many first doses you get. And so we strongly encourage individuals should be getting their second dose where they got their first dose. And the overwhelming majority of individuals are doing that, which is really helping. We do occasionally get requests from individuals who got their first dose one place and are now asking for their second dose. And only in very specific circumstances are we able to honor those requests. Sometimes we don't actually have the type of, if we don't have second doses of Moderna, for example, or other specific situations. And so really, in general, the message should be where you got your first dose is where you should get your second dose, and only under extenuating circumstances are we providing that.
Dr. Sullivan, this is Brett Jensen again. I only asked this because a couple of listeners asked us about this. With the Johnson & Johnson vaccine coming out, it's basically 86% effective in preventing hospitalizations is what the data says. Should people be trying to still get the Pfizer and the Moderna if they have a choice? Some people are worried about, the extra 10% difference between those two and the Johnson & Johnson.
Yeah, so I think 85% in preventing severe disease, and I think, highly effective, again, at preventing hospitalization, and there was no deaths reported in the clinical trial. So I think the message right now is if you have the opportunity to get a vaccine, you should get a vaccine. There is, still limited vaccine availability in this community. Our goal is to get as many people vaccinated as quickly and equitably as possible. And I think all of the vaccines right now that are being used, again, really the focus is on their highly effective in preventing severe disease, hospitalization, and death. And that's really what we're trying to do here. And so I think for that question, anybody who has the opportunity to get a vaccine should get a vaccine. And as supply increases and as we learn more, we can see. But right now, I think we're really excited about the Johnson & Johnson vaccine, what we think is an imminent emergency use authorization, and hopefully getting it in our community.
Next question, please.
I'll hop in if no one has one. Sorry, it's Vanessa again with WCNC. Speaking of Johnson & Johnson, and if you haven't read the briefing document, very thoroughly, that's fine. Am I correct in seeing that there haven't been any severe allergic reactions with Johnson & Johnson? It appears they didn't report any anaphylaxis, but I might have been reading it wrong.
It's a good question. I have to admit, I haven't seen that exact data. I know that with any vaccine or any injectable medication or any medication for that matter, there's always a chance of an allergic reaction. That chance is small. And even with the Pfizer and Moderna vaccines, I think overall, when we see how many reactions there have been compared with how many doses have been administered, it's still an incredibly small percentage. Do you think one of the differences between the Moderna and Pfizer vaccine versus the Johnson & Johnson is the Moderna and Pfizer with the mRNA technology, it uses kind of mRNA that's wrapped in lipid particles. And there is thought that some of the allergic reactions may be due to those lipid particles. And the Johnson & Johnson's vaccine doesn't have that. But I think no matter what, there's the still same screening questions are going to be asked. And so depending on the ingredients of the Johnson & Johnson vaccine, anyone who has an allergy to one of those ingredients will not get it. Everyone will still be observed afterwards. And I think time will tell. But overall, all the vaccines are considered to be, overwhelmingly safe with a small number of allergic reactions.
Dr. Sullivan, it's Allison again from The Observer. Could you talk about vaccinations among public health staff? How many public health staff employees have been vaccinated? Or are you still waiting for some of your folks to get vaccinated?
Yeah, so again, I don't have the exact number of who has been vaccinated. We have been following the same North Carolina Department of Health and Human Services guidance with our public health staff. So, group one included initially public health workers who were vital to the COVID vaccine response. And so those working at our COVID vaccine clinics. And then as the definition of healthcare worker expanded to anyone who is providing current in-person patient contact, we included those individuals that are through our clinical services department that fit that criteria, as well as anyone else who fell under group one. And then as we move into group three, we know we have many more public health staff that will fall under group three, and we'll be working with them as well. But I don't have the exact number of who got vaccinated group one.
Next question, please. Any more questions? Last call.